There's been a big story about Angelina Jolie undergoing an elective bilateral mastectomy to reduce her risk for breast cancer. She was found to have a genetic risk for breast cancer based on her being tested for the BRCA gene, which is the breast cancer gene, and there's two versions, 1 and 2. She was stimulated to get this test based on her mother dying of ovarian cancer, and she was found, in fact, to have the gene. She decided to undergo the prophylactic mastectomy to reduce her risk, and she made a very good point of stating that her doctor told her that it would not make her risk 0, but it would reduce her risk of developing breast cancer from 87% down to about 5%, which is about the appropriate amount. I would say that people who have breast cancer, however, do not need to undergo bilateral mastectomy if they have breast cancer in just one breast. They really should weigh all of their options in terms of their surgical choices for managing their breast cancer. The decision to do bilateral mastectomies for genetically positive people versus those who just have breast cancer is definitely a personal decision that has to be made, but it's not something that needs to be done. People do have the option to undergo lumpectomy or just a single side mastectomy if they're diagnosed with breast cancer. The majority of people who have breast cancer have what we call sporadic cases, meaning that there's no family history for it or no genetic mutation to account for it. There are some people, however, who do need to have genetic counseling or testing if they're diagnosed with breast cancer. Those people would be people who have more than one first-degree relative with breast cancer. It would also be someone who's 40 years old or younger developing breast cancer that needs to have it, and those people who also have a lot of different cancers in their family. So these are things that would prompt us to send a person to genetic counseling, and from there they may be referred for genetic testing.